Okay, so we're first going to start by using the roller, and we're going to focus on rolling the front of the shoulders, the anterior deltoids. So to start, place yourself flat on the floor, place the front of your shoulder on the edge of the roller, hands behind your back, other hand in front, supporting your forehead just for comfort. From here, with small movement, just roll the shoulder forward and back over the area. Once you find that painful spot, hold it for roughly 30 seconds. If it starts to ease, carry on rolling. Do this 2 to 3 minutes minimum, and then repeat on the other side. Okay, second exercise, we're going to focus on the lateral deltoids. Okay, so we're going to hit down to the side of the shoulder. Start by placing your shoulder onto the middle of the roller. Bring your hand behind your back and grasping your forearm of your other arm. Okay, keep it nice and tight. Bend your knees for comfort and just keep them relaxed on the floor. From here, same method, just rolling forward and back over the shoulder till you feel those painful spots. Once you feel one that's particularly painful, hold it on that spot for 30 seconds until it starts to ease, and then continue for another 2 to 3 minutes. See, if you feel this quite easy to perform and you feel the pain subsiding, you can rock forward and back just to add an extra element to the roll. Okay, so the next exercise we're going to go on to is rolling for the lats. Okay, this is usually predominantly an issue for most people when they struggle to bring the arms straight above their head. Okay, it's usually quite tight and restricts that range of motion. So we're going to try and release the lats and increase our range of motion. So to start, place the foam roller, you see where the lats taper in, which will be in line with your sternum. Straighten your arm above your head with your palm up, knees bent for comfort, place your other arm over the top. From here, we're just going to rock forward and back. You'll feel, if you have it in the right spot, as you'll feel obviously the pain immediately, and just keep rolling or keep over that spot until it starts to ease. When you feel it start to ease, you can roll down a little bit further to the next point. Okay, now to increase the intensity a bit, we're going to go into more active release. So from here, put your hand on the floor and the hand above you. So basically turn the palm over, move your arm in into line with your shoulder, out, palm up, and lift above your head. And then repeat 4 times. 2, 3, good. One more. And then from there, return back to the rocking forward and back. Once you return to this, you should feel it ease off and be able to dig in a little bit deeper. And just carry on for about 2 to 3 minutes. Excellent. Okay, what we're going to go on to next, we're going to use the trigger point ball. Okay, you can see it's a lot smaller. You can dig in a little bit deeper, and it's great for release on basically chest work. So we're going to work on the pec minor. So if you're doing this on your own, just find yourselves a wall, get the ball, place it onto your pec, just below your front your shoulder. Place the ball onto the wall, hands straight, and you can basically change the angle of your legs, change the intensity of how far you push your body weight into the ball. And once you're in that position, if you feel it, hold it until it starts to release. If it starts to release, then you can circle, make circular motions onto your chest, which you feel gives it a little bit different element, hits a different part. This adds an element of active release. Okay, this one you can really feel dig into the muscle. Again, do this 4 to 6 times. Afterwards, go back to straight and then carry on circular motions on the wall. Repeat 2 to 3 minutes until it starts to ease, and then repeat on the opposite side. Okay, the next exercise is going to focus more on mobility. Okay, so we're going to look at opening up the shoulders and increasing mobility in the shoulders and upper spine. So to start with, find yourselves a box or a bench. Place the triceps, or basically elbows and half of your triceps onto the box. Bring your hands behind your head, drop your head down. Okay, keep your stomach, suck your stomach in, keep your hips up. Okay, what you don't want to do is arch the lower back to get down lower.
So bring the stomach in, and then try to push your head and your back down. You'll feel this into the shoulders, the lats, and the thoracic spine. You can hold there for about 30 seconds. You should start to feel the movement ease off a bit, become a little bit more mobile, at which point you can push a little bit further down while still keeping the core engaged, keeping the muscles tight. From here,
You can go into single, so split the sides up, so keep one arm on.
bring your other hand around, grab your lats, keep your head down, keep your stomach tight, and just focusing on one side at a time, doing exactly the same thing.
Okay, and that concludes part 2 of trigger point therapy for the upper body. Best way to add these into your program is doing them before or after your exercise, or between sets when you're resting. For example, if you're weight training, doing a leg session, chest session, and you have a 1-minute rest, is perform some of these exercises in between your rest, which will actually help your recovery time and possibly improve your performance as well. I look forward to seeing you in part 3 for the last one.